for connective tissue. Exosome therapy for connective tissue repair and regeneration is an innovative approach leveraging the natural healing properties of exosomes derived from mesenchymal stem cells, MSCs. One of the significant challenges in connective tissue repair is managing inflammation. Excessive inflammation can lead to further tissue damage and impede healing. Exosomes modulate the immune response by delivering anti-inflammatory cytokines and regulatory RNAs, reducing inflammation at the injury site. This creates a more favorable environment for tissue repair and minimizes the risk of chronic inflammation. Exosome therapy for connective tissue involves isolating exosomes from mesenchymal stem cells, MSCs, loading them with therapeutic molecules, and injecting them into the damaged tissue. This promotes tissue regeneration, reduces inflammation, and supports extracellular matrix remodeling, enhancing the healing process and functional recovery of the connective tissue.